Nice. Perfect. Hi, everyone. My name is Abhishek Bhatia. I'm a doctoral student in health informatics at UNC Chapel Hill and a research scientist at Crisis Ready, which is a research response initiative between Direct Relief and Harvard. My background is focused on data-driven responses to humanitarian crises, and today I will be talking about some of my work in post-disaster impact assessment in India, specifically highlighting some of the methods we apply typically towards work outside the US. Climate disasters are increasing in frequency and intensity worldwide. These are just some of the more recent disasters, from floods in Kenya to tropical cyclones in Madagascar to increasing frequency of cold waves in Afghanistan. And so that begs the question, where does research fit in all of this? Across the disaster risk mitigation cycle, our research touches 4 major points, from mapping population displacements during response to return during recovery, to planning and risk assessment in post-disaster stages, some of which my colleagues will talk about today. And I will specifically talk about the post-disaster impact assessments. Historically, they've provided rich context, nuanced information about affected communities, and have had pretty far-ranging societal and political impact. The seminal surveys in Bangladesh from the post-cyclones in the 70s and the 90s show the impact of storm shelters, which drastically reduce flood-related mortality. And more recently, the Hurricane Maria mortality study catalyzed public outcry over the underestimation of the official death toll. So to start, I want to talk about how our lab has historically conducted this in some of the data-rich regions. In 2017, Hurricane Maria, a Cat 5 hurricane, made landfall in Puerto Rico, which led to severe death and damage. The existing administration reported the official death toll at 64, which in that especially sensitive time necessitated peer review, for lack of a better word. So in a study led by some of my colleagues, we used results from our assessment to estimate the excess deaths at 4,645. This number was co-opted by the communities as a call to action for recognition, statehood, and necessary aid. The picture on the right is one of many from protests that followed. So studies like this need to be done responsibly, and how do we do this? Typically, the first step of our pipeline involves gathering basic administrative data on boundaries, localities, road networks, and population estimates. We map these road networks to understand remoteness levels of affected regions, and then map the extent of the hazard to understand what areas were affected so we know where we should launch our survey. In order to understand who we survey, we care about sampling households. For this, we work with the humanitarian OpenStreetMaps to drop random GPS points on buildings, simulating random sampling. We exclude non-residential homes like toilets, and then we have a sampling frame of people to survey. Sounds easy enough. To collect data where cellular coverage is sufficient, like the United States, we lean towards digital survey data collection, where we can sync surveys as they're collected, query them constantly so we can push updates, make sure the quality of the data is fine. But disasters tend to happen across geographic boundaries. And how does this set of survey deployment that we continuously prescribe translate to contexts that are more sparse? In 2018, the state of Kerala in South India was affected by unusually heavy rainfall, leading to the most severe flood in over a century. Over 1 million people were displaced from their homes, with 500 deaths, an estimated $5 billion in damage. And so the story of each disaster is important for rehabilitation, recovery, adaptation. In this case, it was reported that local governance played a key role in facilitating evacuation. In a state of about 34 million people and 500 deaths, that's quite commendable. Our assessment aimed at quantifying the role of the government in facilitating evacuation. So we tried to draw the Hurricane Maria pipeline to India And India has a completely different ecosystem of data, which meant that often the traditional methods fell short. In India, the absence of ready geographic data meant that we needed to request shapefiles from the government. Compared to our ability to map hurricane extent and road networks in Puerto Rico, we relied on the state government's text messaging-based service, where community members would text in reported damage and landslides, so we knew what areas were actually affected once we geotagged it. In Puerto Rico, we dropped pins on digital rooftops to sample households. In India, we traveled to local record-keeping agencies, digitized handwritten household addresses, and then sat with 170 village council members to verify whether these registries were up to date. Finally, with no ability to have local context, we partnered with a state-run women's empowerment organization, which both allowed us to navigate the field very responsibly, but also brought in a level of communal trust that we needed for the survey. And the results of our research here was used in two forms. First, we applied methods in causal inference to validate that the government's early warning did in fact work. Specifically, we found that households that received early warnings were over 2 times more likely to evacuate. Specifically, those that were contacted in person by the government were about 1.5 times more likely to evacuate compared to just receiving radio notices. And this was important because as the government continues to think about how they're building out their early warning systems in some of these nascent spaces, it's important to figure out what works and what doesn't. In this era of AI and machine learning, the snazzy result that everyone was excited about was, can we predict whether people leave or not? And we were. Even with this data sparse issue, we were able to use this data for predictive modeling to understand characteristics that were typically predictive or prohibitive of household evacuation, from risk perception to debt, to pre-existing health conditions, dependence. As a key takeaway, I want to note that consequences of climate change are indiscriminate. When I started to think about the intersection of my field with the concept of sustainability, I thought about whether the existing science that we interact with in the US can be translated to other contexts. I realized that making sure that the products of my research were sustainable meant that they were reusable, accessible, translatable across other contexts, usable by communities. In the contrast in the methods that we used in Puerto Rico and India, the methods were not immediately translatable, limiting how timely and reproducible our first response was. Without support from local governance and communities, none of our academic research would have been applicable. I want to point to 2 future streams of work. The pandemic highlighted the need for us to collaborate a lot more and broke down a lot of the academic silos that we exist in. Recently, in regions where we have not been able to collect data, we shifted to collaborate with the private sector, which unfortunately holds a lot of the data. And in partnership with the public sector, have leveraged cellular phone-based mobility data to understand evacuation and displacement. This has led to some amount of movement towards policy change and practice in the private sector as well. Finally, as South Asia builds its pipeline for data-driven responses to climate change, I want to point to an initiative called ClimateVerse, which is an ongoing collaborative effort in the region that collates and structures climate change data in collaboration with the Dataverse repository with best practices in curation, layers of generative AI to allow people with lower digital literacy to access some of these data so that they're more accessible in the future. With that, thank you very much. Open for questions.
Questions?
Yes.
Thank you for a great presentation. What accounted for the discrepancy in the Hurricane Maria number?
This was actually a large conversation on GitHub. I think, in general, counting deaths is difficult. attributing deaths to disasters is difficult as well. In the immediate aftermath, some of the estimation was low, partially because the record keeping just hadn't been updated, and partially because the way we quantify deaths and collect records on deaths in the US is not ideal for reporting mortality. Shortly after this study, there was a study that was done in partnership with the government, which updated the official death counts to about 3,000. Some of the discrepancy between the study that my colleagues did and the study that the government did is just in the way that you attribute deaths to disasters. That being said, I think that was still a significant jump from that 64 to 4,000. As a sidebar, this was also a huge effort in scientific communication because from a statistical point, that single number is just what we call a point estimate. There was a huge error bar that the graph showed, which I don't think people really process as the value could fall anywhere in that range. And so when people started latching on to 4,645, I think there was a lot of need for better communication that had to happen. So lessons for us.
Other questions? I'll just add that this is a great example of things that maybe don't feel like they connect. We just recently stood up an environmental resilience committee within Sustainable Carolina, and the idea of translatable processes and understanding our challenges related to sustainability and things like heat and flooding, and of course are none of the scale that Abhi's talking about today, but the methods I think will translate, and we can do smart things with data, and hopefully our administrative data will be quite accessible.
Thank you.
All right, thank you so much.